Hi, everyone. This is Nurse Anna from nursestudy.net. We have 75 integumentary disorder nursing questions and answers. If you want to have some questions and answers on a certain topic, please put it in the comments below. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A patient presents with a large, non-healing wound on their lower leg, characterized by a foul odor, purulent discharge, and necrotic tissue. Which of the following is the nurse's priority action? A. Apply a hydrocolloid dressing to the wound. B. Initiate intravenous antibiotic therapy. C. Perform a wound culture and sensitivity test. D. Refer the patient to a wound care specialist. Answer and rationale. C. Perform a wound culture and sensitivity test. The priority action is to perform a wound culture and sensitivity test to identify the causative organism and guide appropriate antibiotic therapy. While antibiotics and specialized care may be necessary, obtaining an accurate diagnosis is crucial for effective treatment. Question 2. A patient with a severe burn injury to the upper body develops significant edema and decreased urine output 8 hours post-injury. Which of the following complications should the nurse suspect? A. Sepsis. B. Hypovolemic shock. C. Acute renal failure. D. Hypernatremia. Answer and rationale. B. Hypovolemic shock. The patient is likely experiencing hypovolemic shock due to fluid loss from the burns, leading to decreased circulating volume and renal perfusion. Early signs include significant edema and decreased urine output. Question 3. Which of the following interventions is most appropriate for a patient with Stevens-Johnson syndrome in the acute phase? A. Administering systemic corticosteroids. B. Providing aggressive fluid resuscitation. C. Applying silver sulfadiazine to affected areas. D. Initiating broad-spectrum antibiotic therapy. Answer and rationale. B. Providing aggressive fluid resuscitation. Stevens-Johnson syndrome can cause extensive skin loss and dehydration, making aggressive fluid resuscitation critical to maintain hemodynamic stability and prevent shock. Question 4. A patient with psoriasis presents with erythrodermic psoriasis involving over 90% of their body surface area. Which of the following nursing interventions is a priority? A. Administering topical corticosteroids. B. Initiating phototherapy. C. Providing warm blankets and monitoring body temperature. D. Educating the patient about avoiding triggers. Answer and rationale. C. Providing warm blankets and monitoring body temperature. Erythrodermic psoriasis can lead to thermoregulatory dysfunction and hypothermia. The priority is to maintain the patient's body temperature and provide supportive care. Question 5. A patient with a suspected malignant melanoma on their back is scheduled for a biopsy. Which of the following findings would most likely indicate a poor prognosis? A. A lesion that is 4 mm in diameter. B. A lesion with irregular borders and multiple colors. C. A lesion with a positive family history of melanoma. D. A lesion that has been present for less than 6 months. Answer and rationale. B. A lesion with irregular borders and multiple colors. Irregular borders and multiple colors are indicative of malignant melanoma and often suggest a more advanced and aggressive form of skin cancer, which can correlate with a poorer prognosis. Question 6. A patient presents with a rapidly spreading rash, fever, and a positive Nikolsky sign. Which of the following conditions should the nurse suspect? A. Erysipelas. B. Bullous pemphigoid. C. Toxic epidermal necrolysis. D. Erythema multiforme. Answer and rationale. C. Toxic epidermal necrolysis. Toxic epidermal necrolysis is characterized by widespread erythema, skin detachment, and a positive Nikolsky sign. It is a life-threatening condition requiring immediate intervention. Question 7. A nurse is caring for a patient with a large decubitus ulcer on the sacrum that extends into the muscle tissue. Which of the following is the most appropriate nursing action? A. Applying a wet to dry dressing. B. Performing debridement. C. Using a negative pressure wound therapy (NPWT) system. D. Administering oral antibiotics. Answer and rationale. C. Using a negative pressure wound therapy (NPWT) system. NPWT is effective for large, deep wounds as it promotes granulation tissue formation, reduces edema, and removes exudate, which can aid in the healing process. Question 8. Which of the following statements by a patient with systemic lupus erythematosus, SLE, indicates a need for further teaching about managing photosensitivity? A. I will wear sunscreen with an SPF of at least 30 when going outside. B. I can stay in the sun for up to 30 minutes without protection. C. I should wear protective clothing, like long sleeves and hats. D. I need to avoid tanning beds and direct sunlight. Answer and rationale. B. I can stay in the sun for up to 30 minutes without protection. Patients with SLE should avoid prolonged sun exposure as it can exacerbate symptoms. This statement indicates a misunderstanding of the importance of constant protection from UV radiation. Question 9. A nurse is assessing a patient with suspected cellulitis of the left lower leg. Which of the following findings would be most concerning? A. Localized redness and warmth. B. Presence of red streaks extending from the leg. C. Pain and tenderness at the affected site. D. Mild swelling of the leg. Answer and rationale. B. Presence of red streaks extending from the leg. Red streaks extending from the infection site indicate lymphangitis, which can lead to systemic infection and requires immediate medical intervention. Question 10. A patient with a history of atopic dermatitis is experiencing an acute flare-up with severe pruritus and erythematous lesions. Which of the following medications is most appropriate for initial management? A. Topical antibiotics. B. Oral antihistamines. C. Systemic corticosteroids. D. Topical calcineurin inhibitors. Answer and rationale. C. Systemic corticosteroids. In severe flare-ups, systemic corticosteroids can reduce inflammation and pruritus effectively. Topical treatments and antihistamines may also be used, but systemic corticosteroids are often needed for acute management. Question 11. A patient with pemphigus vulgaris presents with widespread blistering and mucosal involvement. Which nursing intervention is a priority? A. Administering intravenous immunoglobulin, IVIG. B. Applying topical antifungal agents. C. Maintaining strict oral hygiene and hydration. D. Initiating phototherapy. Answer and rationale. C. Maintaining strict oral hygiene and hydration. Pemphigus vulgaris can cause painful oral lesions, making oral hygiene and hydration crucial to prevent secondary infections and maintain comfort. Question 12. A patient presents with multiple, itchy, raised wheals on their body, consistent with chronic urticaria. Which of the following treatments should the nurse anticipate the healthcare provider will order? A. Oral corticosteroids. B. Antihistamines. C. Antibiotics. D. Topical corticosteroids. Answer and rationale. B. Antihistamines. Antihistamines are the first-line treatment for chronic urticaria, as they help reduce itching and the formation of wheals. Oral corticosteroids may be used in more severe cases, but antihistamines are typically the initial treatment. Question 13. Which diagnostic tool is most appropriate for assessing the depth and severity of a burn injury? A. Skin biopsy. B. Wood's lamp examination. C. Doppler ultrasound. D. Laser Doppler imaging. Answer and rationale. D. Laser Doppler imaging. Laser Doppler imaging is a non-invasive tool that assesses burn depth by measuring blood flow, helping to determine the severity of the injury and guide treatment decisions. Question 14. A patient with scleroderma complains of difficulty swallowing and severe heartburn. Which nursing intervention is most appropriate? A. Instructing the patient to eat small, frequent meals. B. Advising the patient to drink large amounts of fluids with meals. C. Encouraging the patient to lie down after eating. D. Suggesting the patient avoid cold foods. Answer and rationale. A. Instructing the patient to eat small, frequent meals. Patients with scleroderma often have esophageal involvement, leading to dysphagia and GERD. Small, frequent meals can help manage symptoms by reducing esophageal pressure and acid reflux. Question 15. A nurse is caring for a patient with impetigo. Which of the following infection control measures is most important to implement? A. Placing the patient in a private room. B. Applying contact precautions. C. Using airborne precautions. D. Initiating droplet precautions. Answer and rationale. B. Applying contact precautions. Impetigo is highly contagious and spread through direct contact with lesions. Contact precautions, including the use of gloves and gowns, are essential to prevent transmission. Question 16. A patient with a long-standing history of eczema presents with multiple vesicles and a sudden increase in itching and discomfort. Which of the following complications should the nurse suspect? A. Psoriasis. B. Secondary bacterial infection. C. Contact dermatitis. D. Herpes simplex virus infection. Answer and rationale. B. Secondary bacterial infection. Eczema can lead to skin barrier disruption, increasing the risk of secondary bacterial infection, which can present with increased itching, vesicles, and discomfort. Question 17. A nurse is teaching a patient with rosacea about lifestyle modifications to reduce flare-ups. Which of the following statements indicates effective teaching? A. I should avoid spicy foods and hot beverages. B. I can use over-the-counter steroid creams to manage symptoms. C. It's okay to consume alcohol in moderation. D. I should expose my face to the sun to help dry out the lesions. Answer and rationale. A. I should avoid spicy foods and hot beverages. Spicy foods and hot beverages can trigger rosacea flare-ups. The patient should avoid these triggers to help manage symptoms. Question 18. Which of the following clinical manifestations would suggest to the nurse that a patient with a pressure ulcer may be developing osteomyelitis? A. Increased exudate from the ulcer. B. Erythema and warmth around the ulcer. C. Fever and elevated white blood cell count. D. Foul-smelling odor from the ulcer. Answer and rationale. C. Fever and elevated white blood cell count. Fever and elevated WBC count indicate a systemic infection, which can occur if a pressure ulcer progresses to osteomyelitis, a serious bone infection. Question 19. A patient is admitted with a diagnosis of necrotizing fasciitis. What is the nurse's priority intervention? A. Administering broad-spectrum antibiotics. B. Preparing the patient for surgical debridement. C. Applying topical antimicrobial agents. D. Initiating wound vacuum-assisted closure, VAC, therapy. Answer and rationale. B. Preparing the patient for surgical debridement. Necrotizing fasciitis requires immediate surgical intervention to remove necrotic tissue and prevent further spread of the infection. Antibiotics and other treatments are secondary to surgical debridement. Question 20. A nurse is developing a care plan for a patient with herpes zoster, shingles. Which of the following interventions should be included to manage pain and discomfort? A. Applying cold compresses to affected areas. B. Administering antiviral medication. C. Providing acetaminophen for pain relief. D. Using a combination of opioid analgesics and gabapentin. Answer and rationale. D. Using a combination of opioid analgesics and gabapentin. Opioid analgesics combined with gabapentin are effective in managing the neuropathic pain associated with shingles. Antiviral medication is also important but specifically addresses the viral replication rather than pain management. Question 21. A patient with hidradenitis suppurativa presents with multiple painful nodules in the axillary region. Which of the following treatments should the nurse anticipate the healthcare provider will order? A. Oral antibiotics. B. Topical corticosteroids. C. Surgical drainage. D. Antifungal therapy. Answer and rationale. C. Surgical drainage. Hidradenitis suppurativa often requires surgical drainage of abscesses and nodules to relieve pain and prevent further infection. Question 22. A nurse is providing discharge instructions to a patient with a newly diagnosed basal cell carcinoma who is scheduled for Mohs surgery. Which statement should be included in the teaching? A. Mohs surgery has a high cure rate for basal cell carcinoma. B. You will likely need radiation therapy after surgery. C. Expect significant scarring after the procedure. D. The procedure is usually done under general anesthesia. Answer and rationale. A. Mohs surgery has a high cure rate for basal cell carcinoma. Mohs surgery is highly effective for basal cell carcinoma, with a high cure rate and minimal tissue removal, resulting in less scarring compared to other surgical methods. Question 23. A patient with systemic sclerosis presents with digital ulcers and Raynaud's phenomenon. Which of the following interventions is most appropriate to manage these symptoms? A. Administering calcium channel blockers. B. Applying topical corticosteroids. C. Using cold compresses on the hands. D. Encouraging vigorous hand exercises. Answer and rationale. A. Administering calcium channel blockers. Calcium channel blockers are effective in treating Raynaud's phenomenon by improving blood flow and reducing the frequency and severity of vasospastic attacks. Question 24. Which of the following nursing interventions is appropriate for a patient with contact dermatitis caused by exposure to poison ivy? A. Applying topical antibiotics to the affected areas. B. Administering oral antihistamines and corticosteroids. C. Using alcohol-based lotions to dry out the rash. D. Encouraging frequent washing with soap and water. Answer and rationale. B. Administering oral antihistamines and corticosteroids. Oral antihistamines and corticosteroids help reduce the inflammatory response and itching associated with contact dermatitis from poison ivy exposure. Question 25. A patient with newly diagnosed bullous pemphigoid is prescribed high-dose corticosteroids. Which of the following nursing interventions is essential to monitor for potential complications of this treatment? A. monitoring blood glucose levels. B. Performing frequent skin assessments. C. Encouraging a low-sodium diet. D. Administering prophylactic anticoagulants. Answer and rationale. A. Monitoring blood glucose levels. High-dose corticosteroids can cause hyperglycemia, so monitoring blood glucose levels is essential to manage potential complications. Question 26. A patient presents with a chronic venous leg ulcer. Which of the following interventions should the nurse prioritize to promote healing? A. Elevating the affected leg above heart level. B. Applying compression therapy. C. Administering oral antibiotics. D. Using heat therapy to increase blood flow. Answer and rationale. B. Applying compression therapy. Compression therapy helps improve venous return and reduce edema, which is critical for the healing of venous leg ulcers. Question 27. A nurse is caring for a patient with a large, infected diabetic foot ulcer. Which of the following is the most appropriate action to prevent further complications? A. Applying honey-based dressings. B. Initiating strict glycemic control. C. Using occlusive dressings. D. Encouraging the patient to ambulate frequently. Answer and rationale. B. Initiating strict glycemic control. Strict glycemic control is essential in managing diabetic foot ulcers to prevent infection and promote healing. Question 28. A patient with a history of chronic eczema presents with new onset of painful, vesicular lesions on the hands. Which of the following conditions should the nurse suspect? A. Dyshydrotic eczema. B. Herpetic Whitlow. C. Psoriasis. D. Contact dermatitis. Answer and rationale. A. Dyshydrotic eczema. Dyshydrotic eczema presents with vesicular lesions on the hands and feet, often associated with itching and pain. Question 29. A nurse is educating a patient with a new diagnosis of vitiligo. Which of the following statements should be included in the teaching? A. Vitiligo is a contagious condition. B. There is no treatment available for vitiligo. C. Phototherapy may help repigment the skin. D. You should avoid all sun exposure. Answer and rationale. C. Phototherapy may help repigment the skin. Phototherapy can help repigment the skin in patients with vitiligo. The condition is not contagious, and treatment options are available. Question 30. A patient with lichen planus presents with pruritic, purple, polygonal papules on the wrists and ankles. Which of the following is the most appropriate treatment? A. Topical antifungal cream. B. Oral antibiotics. C. Topical corticosteroids. D. Phototherapy. Answer and rationale. C. Topical corticosteroids. Topical corticosteroids are the first-line treatment for lichen planus to reduce inflammation and pruritus. Question 31. A nurse is providing care for a patient with pyoderma gangrenosum. Which of the following interventions is most appropriate? A. Administering systemic immunosuppressants. B. Applying topical antibiotics. C. Using a hydrocolloid dressing. D. Encouraging the patient to keep the wound open to air. Answer and rationale. A. Administering systemic immunosuppressants. Pyoderma gangrenosum often requires systemic immunosuppressants to control the underlying inflammatory process. Question 32. A patient with chronic lymphedema presents with recurrent episodes of cellulitis. Which of the following nursing interventions is essential for this patient? A. Administering prophylactic antibiotics. B. Encouraging frequent leg elevation. C. Applying cold compresses to the affected area. D. Using elastic compression garments. Answer and rationale. D. Using elastic compression garments. Compression garments help reduce lymphedema and prevent recurrent episodes of cellulitis by improving lymphatic drainage. Question 33. Which of the following is the most important nursing intervention for a patient with acute eczema exacerbation? A. Applying occlusive dressings. B. Administering systemic corticosteroids. C. Using emollients frequently. D. Providing ultraviolet light therapy. Answer and rationale. C. Using emollients frequently. Frequent use of emollients helps maintain skin hydration and integrity, which is essential in managing acute eczema exacerbations. Question 34. A nurse is assessing a patient with suspected malignant melanoma. Which of the following characteristics is most concerning? A. A lesion that is uniformly tan. B. A lesion with a diameter of 4 mm. C. A lesion with irregular borders. D. A lesion that has been present for years. Answer and rationale. C. A lesion with irregular borders. Irregular borders are characteristic of malignant melanoma and are more concerning than uniform color or small size. Question 35. A patient with necrotizing fasciitis requires debridement. Which of the following nursing interventions is a priority postoperatively? A. Administering broad-spectrum antibiotics. B. Applying topical antimicrobial agents. C. Providing nutritional support. D. Monitoring for signs of systemic infection. Answer and rationale. A. Administering broad-spectrum antibiotics. Administering broad-spectrum antibiotics is crucial postoperatively to control infection and prevent sepsis. Question 36. A patient with systemic lupus erythematosus, SLE, presents with a new onset of a malar rash. Which of the following is the most appropriate nursing intervention? A. Applying topical antibiotics to the rash. B. Encouraging increased sun exposure. C. Administering corticosteroid therapy. D. Using antihistamines for pruritus. Answer and rationale. C. Administering corticosteroid therapy. Corticosteroid therapy is effective in reducing the inflammation associated with the malar rash in SLE patients. Question 37. A patient with epidermolysis bullosa is at risk for infection due to skin fragility. Which of the following nursing interventions is most appropriate to reduce this risk? A. Using hypoallergenic skincare products. B. Applying occlusive dressings. C. Encouraging frequent bathing. D. Administering prophylactic antibiotics. Answer and rationale. A. Using hypoallergenic skincare products. Hypoallergenic products help prevent skin irritation and breakdown, reducing the risk of infection in patients with epidermolysis bullosa. Question 38. A patient with a severe sunburn presents with blisters and severe pain. Which of the following is the most appropriate nursing intervention? A. Applying topical lidocaine. B. Administering oral corticosteroids. C. Using cool compresses. D. Encouraging exposure to sunlight. Answer and rationale. C. Using cool compresses. Cool compresses help soothe the skin and reduce pain and inflammation associated with severe sunburn. Question 39. A nurse is caring for a patient with chronic urticaria. Which of the following medications is most appropriate for long-term management? A. Oral corticosteroids. B. Antihistamines. C. Antibiotics. D. Topical corticosteroids. Answer and rationale. B. Antihistamines. Antihistamines are the first-line treatment for chronic urticaria and are effective for long-term management. Question 40. A patient with a venous leg ulcer is receiving negative pressure wound therapy, NPWT. Which of the following is an essential nursing action to ensure the effectiveness of NPWT? A. Changing the dressing every 48 hours. B. Monitoring for signs of infection. C. Applying additional dressings over the NPWT dressing. D. Using occlusive dressings to seal the wound. Answer and rationale. B. Monitoring for signs of infection. Monitoring for infection is crucial to ensure the effectiveness of NPWT and prevent complications. Question 41. A patient with severe plaque psoriasis is being treated with biologic therapy. Which of the following assessments is a priority before initiating treatment? A. Complete blood count, CBC. B. Liver function tests. C. Tuberculosis, TB, screening. D. Renal function tests. Answer and rationale. C. Tuberculosis, TB, screening. Biologic therapy can increase the risk of TB reactivation, making TB screening a priority before initiating treatment. Question 42. A nurse is caring for a patient with a deep tissue injury, DTI. Which of the following interventions is most appropriate to prevent further tissue damage? A. Applying heat therapy. B. Providing frequent repositioning. C. Using an occlusive dressing. D. Administering systemic antibiotics. Answer and rationale. B. Providing frequent repositioning. Frequent repositioning helps prevent additional pressure and reduces the risk of further tissue damage in patients with DTIs. Question 43. A patient with pemphigus vulgaris is experiencing painful oral lesions. Which of the following nursing interventions is most appropriate? A. Encouraging a diet of solid foods. B. Using hydrogen peroxide mouthwash. C. Providing a soft, bland diet. D. Applying topical antifungal agents. Answer and rationale. C. Providing a soft, bland diet. A soft, bland diet reduces irritation and discomfort from oral lesions in patients with pemphigus vulgaris. Question 44. A nurse is providing care for a patient with toxic epidermal necrolysis, TEN. Which of the following interventions is essential in the management of this condition? A. Administering high-dose antibiotics. B. Initiating fluid resuscitation. C. Using topical corticosteroids. D. Applying cold compresses to affected areas. Answer and rationale. B. Initiating fluid resuscitation. Fluid resuscitation is critical in managing TEN due to extensive skin loss and fluid shifts, which can lead to hypovolemic shock. Question 45. A patient with systemic lupus erythematosus, SLE, develops a discoid rash. Which of the following is the most appropriate nursing intervention? A. Applying topical antibiotics. B. Administering systemic corticosteroids. C. Using sunscreen and sun protection. D. Encouraging exposure to sunlight. Answer and rationale. C. Using sunscreen and sun protection. Sun protection is essential for managing and preventing exacerbation of the discoid rash in SLE patients. Question 46. A patient with chronic plaque psoriasis is being treated with methotrexate. Which of the following nursing assessments is essential before starting treatment? A. Liver function tests. B. Complete blood count, CBC. C. Renal function tests. D. Chest X-ray. Answer and rationale. A. Liver function tests. Methotrexate can cause hepatotoxicity, making liver function tests essential before starting treatment. Question 47. A nurse is assessing a patient with suspected cellulitis. Which of the following findings would be most concerning? A. Localized redness and warmth. B. Fever and chills. C. Pain and tenderness at the site. D. Mild swelling of the affected area. Answer and rationale. B. Fever and chills. Fever and chills indicate a systemic infection, which is a concerning complication of cellulitis and requires immediate attention. Question 48. A patient with a large thermal burn is experiencing severe pain. Which of the following pain management strategies is most appropriate? A. Administering oral NSAIDs. B. Using opioid analgesics. C. Applying topical lidocaine. D. Encouraging non-pharmacological methods. Answer and rationale. B. Using opioid analgesics. Opioid analgesics are often necessary for managing severe pain associated with large thermal burns. Question 49. A nurse is providing discharge teaching to a patient with newly diagnosed herpes zoster. Which of the following statements indicates effective teaching? A. I should avoid contact with pregnant women and immunocompromised individuals. B. I can continue to share personal items with my family. C. The rash is not contagious to others. D. I do not need to cover the rash. Answer and rationale. A. I should avoid contact with pregnant women and immunocompromised individuals. Herpes zoster, shingles, can be transmitted to those who have not had chickenpox or the vaccine, so avoiding contact with high-risk individuals is important. Question 50. A patient with systemic lupus erythematosus, SLE, develops oral ulcers. Which of the following nursing interventions is most appropriate? A. Encouraging a diet of acidic foods. B. Using hydrogen peroxide mouthwash. C. Providing a soft, bland diet. D. Applying topical antifungal agents. Answer and rationale. C. Providing a soft, bland diet. A soft, bland diet reduces irritation and promotes healing of oral ulcers in patients with SLE. Question 51. A nurse is assessing a patient with suspected basal cell carcinoma. Which of the following findings is most characteristic of this condition? A. A rough, scaly patch. B. A pearly, translucent nodule. C. A firm, red nodule. D. A flat, pigmented lesion. Answer and rationale. B. A pearly, translucent nodule. Basal cell carcinoma often presents as a pearly, translucent nodule, which is characteristic of this type of skin cancer. Question 52. A patient with a history of psoriasis presents with severe joint pain and swelling. Which of the following conditions should the nurse suspect? A. Rheumatoid arthritis. B. Osteoarthritis. C. Psoriatic arthritis. D. Gout. Answer and rationale. C. Psoriatic arthritis. Patients with psoriasis can develop psoriatic arthritis, characterized by joint pain and swelling. Question 53. A nurse is providing care for a patient with systemic sclerosis who has developed finger ulcers. Which of the following interventions is most appropriate? A. Applying topical corticosteroids. B. Using calcium channel blockers. C. Encouraging exposure to cold temperatures. D. Administering oral antibiotics. Answer and rationale. B. Using calcium channel blockers. Calcium channel blockers improve blood flow and reduce the frequency of vasospastic attacks, helping to manage finger ulcers in systemic sclerosis. Question 54. A patient with a chronic venous leg ulcer presents with increased pain and foul-smelling drainage. Which of the following complications should the nurse suspect? A. Arterial insufficiency. B. Osteomyelitis. C. Contact dermatitis. D. Cellulitis. Answer and rationale. D. Cellulitis. Increased pain and foul-smelling drainage suggest an infection such as cellulitis, a common complication of chronic venous leg ulcers. Question 55. A nurse is assessing a patient with suspected pemphigus vulgaris. Which of the following findings is most characteristic of this condition? A. Multiple small vesicles on the hands and feet. B. Large, flaccid blisters on the skin and mucous membranes. C. Thick, scaly plaques on the scalp and elbows. D. Rough, scaly patches on sun-exposed areas. Answer and rationale. B. Large, flaccid blisters on the skin and mucous membranes. Pemphigus vulgaris presents with large, flaccid blisters on the skin and mucous membranes, which is characteristic of this autoimmune condition. Question 56. A patient with a newly diagnosed melanoma asks about the prognosis. Which of the following factors is most important in determining the prognosis? A. Lesion color. B. Lesion size. C. Lesion depth. D. Lesion location. Answer and rationale. C. Lesion depth. The depth of the melanoma lesion is the most important factor in determining the prognosis, with deeper lesions associated with a poorer prognosis. Question 57. A nurse is caring for a patient with severe seborrheic dermatitis. Which of the following treatments is most appropriate? A. Topical antifungal cream. B. Oral antibiotics. C. Systemic corticosteroids. D. Phototherapy. Answer and rationale. A. Topical antifungal cream. Topical antifungal creams are effective in managing seborrheic dermatitis by reducing the yeast that contributes to the condition. Question 58. A patient with a suspected drug reaction presents with a widespread erythematous rash and mucosal involvement. Which of the following conditions should the nurse suspect? A. Erythema multiforme. B. Stevens-Johnson syndrome. C. Toxic epidermal necrolysis. D. Contact dermatitis. Answer and rationale. B. Stevens-Johnson syndrome. Stevens-Johnson syndrome is characterized by a widespread erythematous rash and mucosal involvement, often due to a drug reaction. Question 59. A nurse is providing discharge teaching to a patient with chronic eczema. Which of the following statements indicates effective teaching? A. I should use soap and water frequently to clean my skin. B. I can use any type of moisturizer on my skin. C. I should avoid wearing wool or rough fabrics. D. I should take hot showers to help soothe my skin. Answer and rationale. C. I should avoid wearing wool or rough fabrics. Wool and rough fabrics can irritate the skin and worsen eczema symptoms, so patients should avoid these materials. Question 60. A patient with systemic lupus erythematosus, SLE, presents with new onset of alopecia. Which of the following nursing interventions is most appropriate? A. Administering topical corticosteroids. B. Encouraging increased sun exposure. C. Providing gentle hair care and avoiding harsh treatments. D. Applying antifungal shampoo. Answer and rationale. C. Providing gentle hair care and avoiding harsh treatments. Gentle hair care and avoiding harsh treatments help manage alopecia associated with SLE. Question 61. A nurse is assessing a patient with a suspected fungal infection of the nails. Which of the following findings is most characteristic of onychomycosis? A. Yellow, thickened nails with subungual debris. B. Red, inflamed cuticles with pus formation. C. Brittle nails with horizontal ridges. D. Blue discoloration of the nail bed. Answer and rationale. A. Yellow, thickened nails with subungual debris. Onychomycosis presents with yellow, thickened nails and subungual debris, which are characteristic findings of this fungal infection. Question 62. A patient with lichen planus is experiencing severe itching and discomfort. Which of the following treatments is most appropriate? A. Oral antibiotics. B. Topical corticosteroids. C. Phototherapy. D. Antihistamines. Answer and rationale. B. Topical corticosteroids. Topical corticosteroids are effective in reducing inflammation and itching in lichen planus. Question 63. A nurse is caring for a patient with acute urticaria. Which of the following medications is most appropriate for immediate symptom relief? A. Oral corticosteroids. B. Antihistamines. C. Antibiotics. D. Topical corticosteroids. Answer and rationale. B. Antihistamines. Antihistamines provide immediate relief from the itching and wheals associated with acute urticaria. Question 64. A patient with suspected herpes zoster presents with a painful, vesicular rash along a single dermatome. Which of the following is the most appropriate nursing intervention? A. Administering oral antiviral medication. B. Applying topical corticosteroids. C. Using cold compresses. D. Encouraging increased sun exposure. Answer and rationale. A. Administering oral antiviral medication. Oral antiviral medication helps reduce the severity and duration of herpes zoster symptoms. Question 65. A nurse is providing care for a patient with suspected scabies. Which of the following findings is most characteristic of this condition? A. Thick, scaly patches on the scalp. B. Multiple small, red, itchy bumps in the webbing of fingers. C. Large, fluid-filled blisters on the trunk. D. Rough, scaly patches on sun-exposed areas. Answer and rationale. B. Multiple small, red, itchy bumps in the webbing of fingers. Scabies typically presents with small, red, itchy bumps in the webbing of fingers and other areas where the mites burrow. Question 66. A patient presents with severe itching and hyperpigmented, lichenified plaques on the flexor surfaces of the elbows and knees. Which of the following is the most appropriate initial nursing intervention? A. Applying topical antibiotics. B. Administering oral antihistamines. C. Initiating phototherapy. D. Using emollients and topical corticosteroids. Answer and rationale. D. Using emollients and topical corticosteroids. The initial management for chronic eczema, atopic dermatitis, involves maintaining skin hydration with emollients and reducing inflammation with topical corticosteroids. Question 67. A patient with suspected herpes simplex virus infection presents with grouped vesicles on an erythematous base on the lip. Which of the following diagnostic tests should the nurse anticipate? A. Zinc smear. B. Woods lamp examination. C. Patch testing. D. Skin biopsy. Answer and rationale. A. Zinc smear. A zinc smear is used to diagnose herpes simplex virus infection by identifying multinucleated giant cells. Question 68. A patient with newly diagnosed discoid lupus erythematosus is concerned about scarring. Which of the following is the most appropriate nursing intervention to address this concern? A. Encouraging sun exposure to improve vitamin D levels. B. Advising the use of topical corticosteroids. C. Recommending the use of high SPF sunscreen and protective clothing. D. Suggesting the use of hydrocolloid dressings. Answer and rationale. C. Recommending the use of high SPF sunscreen and protective clothing. Sun protection is crucial in managing discoid lupus erythematosus to prevent lesions from worsening and reduce scarring. Question 69. A nurse is caring for a patient with a suspected fungal infection of the scalp, tinea capitis. Which of the following is the most appropriate treatment? A. Topical antifungal cream. B. Oral antifungal medication. C. Topical corticosteroids. D. Oral antibiotics. Answer and rationale. B. Oral antifungal medication. Tinea capitis is typically treated with oral antifungal medications, as topical treatments are often ineffective for scalp infections. Question 70. A patient with chronic venous insufficiency presents with a stasis dermatitis. Which of the following is an essential component of the nursing care plan? A. Applying wet to dry dressings. B. Elevating the legs and using compression stockings. C. Encouraging frequent walking and exercise. D. Administering systemic corticosteroids. Answer and rationale. B. Elevating the legs and using compression stockings. Compression therapy and leg elevation are essential to manage venous insufficiency and stasis dermatitis by improving venous return and reducing edema. Question 71. A patient presents with multiple nodules on the lower legs that are painful and have a reddish-brown hue. Which of the following conditions should the nurse suspect? A. Erythema nodosum. B. Pyoderma gangrenosum. C. Lipodermatosclerosis. D. Kaposi sarcoma. Answer and rationale. A. Erythema nodosum. Erythema nodosum is characterized by painful, reddish-brown nodules, typically on the lower legs, and is often associated with systemic conditions. Question 72. A patient with a history of psoriasis presents with widespread erythroderma. Which of the following is the most appropriate initial management? A. Administering oral methotrexate. B. Applying high-potency topical corticosteroids. C. Initiating systemic biologic therapy. D. Providing supportive care and monitoring for complications. Answer and rationale. D. Providing supportive care and monitoring for complications. Erythrodermic psoriasis can be life-threatening and requires supportive care, including fluid and electrolyte management, temperature regulation, and monitoring for secondary infections. Question 73. A nurse is assessing a patient with suspected pemphigus foliaceus. Which of the following findings is most characteristic of this condition? A. Flaccid blisters on the skin and mucous membranes. B. Thick, scaly plaques on the scalp and elbows. C. Superficial blisters and erosions on the skin without mucosal involvement. D. Rough, scaly patches on sun-exposed areas. Answer and rationale. C. superficial blisters and erosions on the skin without mucosal involvement. Pemphigus foliaceus is characterized by superficial blisters and erosions on the skin, typically without mucosal involvement. Question 74. A patient with a chronic wound is being treated with a hydrocolloid dressing. Which of the following is the primary benefit of this type of dressing? A. Provides a moist wound environment to promote healing. B. Delivers antimicrobial agents directly to the wound. C. Absorbs large amounts of exudate to keep the wound dry. D. Adheres firmly to the wound bed to prevent contamination. Answer and rationale. A. Provides a moist wound environment to promote healing. Hydrocolloid dressings create a moist environment that supports autolytic debridement and promotes healing. Question 75. A patient with systemic lupus erythematosus, SLE, develops a discoid rash. Which of the following is the most appropriate nursing intervention? A. Applying topical antibiotics. B. Administering systemic corticosteroids. C. Using sunscreen and sun protection. D. Encouraging exposure to sunlight. Answer and rationale. C. Using sunscreen and sun protection. Sun protection is essential for managing and preventing exacerbation of the discoid rash in SLE patients.